So let's jump right into our topic for today. So the reason we are here today is to understand more about the requirements for your MIPS security risk analysis. So as you all might be already doing it, so you're participating in the MIPS program, that's why you are here. And there is a big requirement to conduct, apart from the number of other requirements from the clinical side of things in terms of meeting those numbers and the eligibility criteria and whatnot. You are supposed to be conducting a security risk assessment of your environment. So what does that really mean? So that's what it means here. The objective is to protect the patient health information, and the measure for this one is they do refer to some CFR, which is Code for Federal Regulation, which stands for Code for Federal Regulation, another acronym. And so there are these numbers that are listed here: 164.308A1 and the 164.306. All those things are directly referred from HIPAA. So a lot of times we get questions, how is this security risk analysis different from the HIPAA requirement? Technically, they have MIPS or the CMS agency has not added any new requirement to the providers. So these requirements have been existing already, and if you have been doing the HIPAA assessment regularly on an annual basis, and you should have been conducting the security risk assessment as well. Of course, these regulations and the standards, they are really vague and they don't get very specific into what exactly you need to be doing and stuff. What they have done is, as part of this MIPS program, they have created a specific attestation process. Attestation, essentially, you are saying as a entity who's receiving money or who's receiving incentive, saying that like you have completed that specifically. So there is for HIPAA requirement, there is no attestation per se, right? Unless you get audited by the OCR and other agencies or the state agency, you don't need to really attest every year to go into a portal and attest. Whereas like for the MIPS program, they have made this as a kind of a mandatory requirement. Right. Let's look at why are we talking about this topic today. The reason being, as you could see from the numbers here, CMS went about doing audit of about 10% of the entities who have received the payments. There are, we don't have the exact numbers, probably anywhere from 100 to 300,000 eligible hospitals and providers have participated in this incentive program. This is a very popular program, by the way, though. So, and they went about conducting audits of about 10% of the entities, and what they have figured out is there are about 22.7% of the eligible professionals here. Like probably you can take them as solo clinics, individuals, non-hospitals, and then the hospital. So about 5% of the hospital, they haven't met the requirement for the security risk assessment, right? So so what essentially it means, the repercussions are pretty big. So they could go back and pretty much ask all the incentives or all the money that they have provided to you as part of this program because you failed in their audit. So we have interacted with several of our customers who have gone through this audit. Of course, sometimes it gets pretty exhaustive, but some of them have passed it, some of them couldn't finish it because this is conducted point in time, right? So, and also this is something you should have done it. Let's say if CMS is auditing your paperwork for 2021, you cannot go back in time and conduct the security risk assessment as of 2021. You cannot, let's say if once you get this audit request, then like you cannot go and complete your security assessment unless you want to backdate this thing, which is not recommended, right? So what you want to do is you want to be cognizant about the requirement, and you want to be making sure that you are conducting these assessments during the performance period. Let's say you are attesting for 2020 2 in the beginning of 2023, then you should have started thinking about it now, or you should have at least started conducting your security risk assessment now, right now, right? So that's the reason actually we are talking about this topic. And so this is the finding. So we obviously want to learn from others, and what we want to recommend as part of the whole the security risk assessment only, because as providers or like as the overall entity managing the business, you all understand the clinical requirements of things, and you know the numerator, the denominator requirements, how many patients you need to see, and how many patients need to be meeting some of those requirements and the overall requirement for the MIPS. What the providers are lacking from our earlier slide is, they don't understand the requirement of the security risk assessment, right? So that's why we are talking about that topic today. And then when it comes to your MIPS SRA, what you want to, kind of keep few things in mind is, one is, first thing they would ask is, show me the document, show me the report, right? So you got to have something to prove. If you say, hey, you've done it, then like they're going to ask, okay, show me the evidence, and you cannot say like it was done without providing the document, right? That would be considered as you haven't conducted the audit, conducted the assessment. So that's number one. Number two, what they are looking at is, they are not expecting you to be 100%. Right, so there are these different requirements, probably about 60 to 70 different controls within this SRA space. They are not expecting you to be 100% completed with respect to this particular requirement. They are expecting you to review everything with respect to your EHR implementation, with respect to how you are handling patient data, and then they want you to identify the risk and have some kind of plan. What does a plan mean? Plan means you have some kind of specific action items in terms of remediating or mitigating the risk that you have identified as part of your security risk assessment, and have a definite start time and definite end time in terms of when you are going to be finishing those things. That's what the plan means. So that's what they are going to be asking you. Okay, apart from this document, okay, does that document cover your identification of risk? Does that document cover the remediation of those risks, and does it have a specific date, time to mitigate those risks and stuff? And then the third thing that they are specifically looking, going back to my earlier comment, you should have conducted that during the performance period, right? So there is no ifs and buts about it. So if you are conducting this assessment in the beginning of 2023, probably you are not eligible for submitting it for 2022. Right, so you have to conduct it during the performance period. Performance period is between Jan 1st of the 2022 to December 31st of 2022. So it should have been done sometime during this year. It doesn't matter when exactly, but it's sometime during this one. So what is how is this scored? The MIPS SRA base score is yes. So the base score, essentially the idea here is all of the base score requirements needs to be met, right, no matter what. So you cannot skip them, or it's not kind of optional. And then so there is no specific score, performance score for this particular one, because they are CMS is considering this as like some of the fundamental requirement for handling data and exchanging data and whatnot. And then does it also qualify you for eligible bonus? Nothing. So there is nothing. So this is something, a very base measure that needs to be completed, and then and without that, like, you will not be able to even get any incentive and whatnot, right? So as we've highlighted here the last line, so if you are submitting no for this particular measure, your base score is going to be 0, right? So that is the way it is done. So here are some of the the high level requirement summary. I think like we kind of covered that. One of the important thing that I wanted to cover is, so you should have been running your EHR system, that's a certified EHR system in 2015 or higher. So that is like another requirement as part of this particular SRA. So yes, all Medicare, like if you're attesting for Medicare or Medicaid, for both, you need to complete this. And then what is an attestation, as we discussed earlier? So this is not like a certification per se. You don't need to get the security risk assessment certified by somebody, someone. So what essentially it means is anyone can do this. And, like as long as you think as a business, so whoever is doing it is qualified enough to conduct this assessment, then you're good. And then what does it mean legally? Attestation sounds a little bit unique term, right? So it means legally you are saying that you have understood the requirement, you are able to demonstrate and meet the objective, right? So that's what it means. So so you are supposed to be maintaining all the supporting documentation, as I mentioned earlier, whether it is paper or electronic format and whatnot. You need to maintain it. And then so you're required to maintain the whole records for up to 6 years. And you could be potentially audited by CMS or the state HHS anytime, like within that 6-year period. So how do you go about even starting this security risk analysis? So everything depends, right? So it depends on the size of your organization, whether you're a small practice or a big hospital or a specialty, not really hosting anything and stuff. And then it depends on the size of your organization, in the sense like, how many sites you have, and whether you are having on-prem servers, or like whether you are using just a cloud-based services and whatnot, just with your laptop and mobile phones. And then also it depends on your complexity of technology and whatnot. So your security risk analysis is going to vary widely, right, based on some of the things that we are talking about. And also, of course, depending on whether you have a single site or you have multiple sites, whether you have the same system or multiple systems and whatnot. So the general requirement with respect to the security risk analysis is all of these areas. It might sound a little bit exhaustive, right? Like, but to conduct a comprehensive security risk assessment, these are like some of the things you need to be considering. So if you are doing it yourself, you definitely want to think about some of these things that are listed here. I'm not going to go through this individually, just in the interest of time. But as Aditi said, like we have the handout available for you to download. If you have any questions, specific questions and things, we'll be happy to answer after our prepared presentation, or like even we will be available via email to answer any questions. So the couple of things that I wanted to bring up to your notice, one is number 2, that is policies and procedures. So a lot of times when we go into any organization, we don't see any security policies or procedures and whatnot. So this is something actually you definitely need to have. So what essentially does that policy contain? So it contains about your overall requirements for managing the patient data. It would say, how would you provide access to a system? How would you terminate a user? And how would you handle the data? How would you classify it? How do you back it up? So the whole 9 yards that requires for maintaining the security of the data. So that is one. So we don't see that a lot. So the best way to probably get started on that one, if you're a small to medium size, we do have several templates just in case if you're interested. So start off with a template instead of creating everything from scratch. Start with the template, update the required sections, and then at least you will have you will be in a pretty decent place to start with. And the next one is essentially the physical security. Most of the places that we are conducting assessment now, like they don't have any on-prem or on-site servers and other like equipments. Most of them are all on the cloud, and they probably have some kind of a wireless router that gets plugged into their ISP. That's pretty much it. And then they all work off of their laptop or workstation, right? So in that case, the physical security requirement are little bit minimal, right? And depending on your environment, again, as is going back to our earlier this thing, not all of them is applicable for everybody, depending on the scoping exercise that we do initially. So some of them are going to be applicable, some of them are not. Right. So the way like we kind of cover as part of our security risk analysis is like we take this like 6 major areas, right? So your EHR system, your desktop laptops, your mobile devices, and your networking. And if you have any removable media and stuff, so those are like some of the areas. And then also, your other system that are talking to your core EHR system, say for example, your the patient portal and any kind of third-party service that connects to your core EHR system, including the HIE, the HIE exchange, information and whatnot. So those are like some of the things that we kind of cover as part of our this assessment. So couple of things on this particular topic. We've got a lot of calls from our physician community and also hospital saying that they are using a certified EHR, they are using a cloud-based EHR, so they are not required to do the security risk analysis. So that is definitely a myth. We've seen in a lot of audit, people fail their audit because they said like they are using a certified EHR. Why should they conduct the security risk assessment? And also they said, hey, okay, cloud-based EHR, so they are responsible. Our cloud vendor is responsible, whether you use Athena Health or Cerner or whatnot, right? So they said like they are responsible. So both of them are wrong. So as an entity who is subscribing to some of the services, you have to conduct your own assessment. So the scope for that might be a little bit different from what the EHR vendor and other vendors are covering. But for you, like you need to have your own independent security risk assessment done. Right. So let's quickly go over some of the areas that you need to be covering if you are conducting the security risk analysis. So especially when it comes to EHR, no matter whether you are using on-prem EHR or like you're using a cloud-based EHR, you definitely need to configure it according to your the policies and procedures that we discussed earlier. So what do we mean by configuration? So for example, are you going to allow remote connections to your EHR? And if yes, then like there are some configuration setting that you could do, or like you can restrict the connection based on certain IP addresses and stuff. So all of this security related configuration. So in terms of defining the password requirement, defining the timeout parameters, updating the patches and whatnots, all of these things, you are responsible for it. So you need to, as a customer, like you need to make sure that you are configuring it according to your requirements and according to what is the best practice and stuff. And then again, like creating roles within the EHR system and assigning them so that like only people have access based on need to know, right? So that's very important as well. So that will be your responsibility. Although there are certain shared responsibility with your cloud provider. So a lot of the things that are highlighted here are your responsibility, including reviewing the logs regularly to make sure that only the right people are accessing the data and right people are doing what they are supposed to be doing. Right, so that is all the requirement. So all of the things that we are talking about here requires some sort of evidence for you to maintain, right? So for example, if you're conducting audit log reviews, your responsibility is to demonstrate that in case if there is any CMS audit. So what you need to be doing is you need to be downloading this audit log files and then annotating the log files if there are any kind of anomalies that you see. Or like what you need to be doing is like you will be communicating with probably your IT team and other vendors, and so those are like some of the evidence that you need to maintain in case if there are any audit. So it's not enough to say, hey, okay, so we have done the review, and then they are going to be asking, the auditor are going to be asking, what was your process, and what, can you show us some evidence of how you went about doing the audits and stuff. So moving on to the next one, desktops and laptops. Here are again the best practices that you want to make sure that you have in place. Of course, when it comes to desktop and laptop, definitely we do recommend some sort of advanced antivirus and EDR solution, right? We call it endpoint detection and response software, so that when there is any kind of attack that's happening. Most of the time, if you see like all the hacks and all the data breach news that we read, everything starts with some kind of end device that is not protected properly. So a hacker gets into your network through the weakest point, right? So that's why the antivirus and the malware is all like kind of critical. And then making sure that you update your Windows or Apple, whatever you run, whatever OS that you run, making sure you update them. And if you have a large group of people, making sure you have some sort of RMM, the remote monitoring method, to make sure that you are updating all the OS and the patches regularly, and timing out, logging out people if they are inactive after say like 10-15 minutes is usually the best practice. So you don't want to leave your computer on and walk away to do something else and then come back and see somebody else has logged in, right? So and also the most important part is there is no unencrypted patient data on your desktop and laptop. So essentially the reason we are recommending that is if you are going to be encrypting your laptop and desktop, then the burden of proof is just to demonstrate that you have used the right technology to encrypt it, right? So if you haven't encrypted it, then the burden of proof is to make sure that data was not accessed by anybody else, even if you, let's say, you lose your laptop or somebody breaks into your office and stuff, right? So that's why the encryption is something that we definitely recommend, especially for laptops, desktops, and also your mobile devices and things. So the next item here is like, of course, more mobile-based device, like say your phones, right? So texting and emailing, checking your emails with that potentially might contain some kind of patient data and stuff is becoming very, very common. So obviously what you want to do is like you want to have some sort of, they call it MDM, a mobile device management solution, whether it is your company provided phone or even personal BYOD, bring your own device type of thing. So you want to make sure that all these devices are kind of in a way monitored. And you could do some kind of a remote wipe if the devices are lost, and you do have some advanced protection, including password and the encryptions and whatnot, right? Those are like some of the things we will be looking at when we are doing assessment of the mobile and tablet device. Then the next one is, of course, the networking devices. Even if you are a small shop, you're going to have some sort of wireless router, firewall, and whatnot. So you want to make sure that some of the things that are listed in here are all covered as part of security risk analysis, and you have a better understanding of those devices, right? So the scanning of your networking device, if you have some kind of a public interface, VPNs and whatnot, and then most of these equipment come with default username password. You can just Google their look at the make and model, and then Google the default username password. If you don't change it, then anybody can access it. And then of course the firmware updates and configuring the locks and encrypting the traffic, and all those things are pretty important as well. So this one is also a major issue in the healthcare space. So that's why we kind of calling it out separately, removable media. So especially like thumb drive, USB, and backup tape, CDs, any kind of media that stores, even portable hard disk and stuff. So any kind of media that stores patient data and stuff, everything needs to be in scope. And then what you want to do is definitely want to encrypt them. So even if you lose them, nobody can access it unless they have the encryption key. And then when you're disposing it off, you want to make sure that you follow certain guidelines to dispose it off safely, so that like even if somebody else get access to those media, they won't be able to recover the data. And then especially when it comes to this removable media, you need to maintain an inventory of all these assets within your organization, and make sure that you have a custodian for each one of them, right? Then the next one is pretty much everything else, right? So whether you're talking about emails, whether you're talking about health information exchange platform and the patient portal and whatnot, everything else, right? So you want to make sure that all these integration points are also secured as part of your analysis, and you have some kind of comfort level in terms of allowing them to have access back and forth to your environment, right? So those are like including copiers, printers, we're calling it out. The reason being, we've seen few incidents where the copiers were disposed of without properly sanitizing. So the company, which it was CVS in this case, ended up paying some penalty because the hard disk that was in the copier printer were not wiped out properly. Right. So those are like some of the things that you want to consider as you are, conducting the security risk assessment. I think like we specifically calling out the security awareness training. So that is, one of the key part of the security risk assessment. So no matter what, whoever is handling the patient data, you want to have some sort of program to train them, and also, send them some phishing emails and see whether they are clicking on it by mistake. If yes, then that means they probably need a little bit additional training so that they don't click that link next time around.
For more information, click on the link below or visit databrackets.com.